Left main PCI is increasingly performed and can be technically challenging, can we say, even potentially risky considering the large amount of supplied myocardium. So in the October 24th issue of JACC Interventions, there is a paper, Operator Experience and Volume on Outcomes After Left Main PCI. And to talk about this, I am with Professor Bo Zhu, who is from Fu Wai Hospital in the National Center for Cardiovascular Disease, Chinese Academy of Medical Sciences in Beijing. This is a fascinating paper. First off, thank you very much. This is really a difficult setting, correct? This is why this is so important.
Yeah, thank you very much. I think just like you mentioned, left main PCI is increased performed by the worldwide operators. However, I think it's so important when the Excel trials will be announced tomorrow. Maybe everything changed, but operator experience and volume should play an important role in the future, in the near future.
Right.
Yeah.
Why did you do the study? What gave you the idea to do the study?
Because every idea came from our practice, because Fu Wai Hospital probably is the largest PCI center in the world. For example, last year I performed more than 15,000 PCI. Should be the number one in the world, but we observe the difference between experienced and less experienced operators.
So you decided to look at it across a broad group of people and see what it is.
It's easy to understand. For example, the complex procedures such as left main PCI, the operator experience play more important role than the regular PCI.
So how many patients did you study? What did you find?
Yeah, actually this is a long-term retrospective study, and from year 2004 to year 2011, 8 years, a total of 1,948 left main PCI consecutive patients were studied. Among them, all of these cases were treated by 25 operators. So 7 operators, so-called experienced high volume operator, performed 73%, and the other 27% of left main PCI was performed by another 18 operators. So we define this experienced high volume operator as an operator who can perform at least 15 left main PCI per year and perform left main PCI consecutively for 3 years.
Yeah, that's a lot of procedures.
So actually, mean left main PCI for a high volume operator 25 per year, and the low volume operator 4 cases per year.
So what did you find? There's obviously a connection. There better be, I would think.
Yeah. So-called we are discussing the long-term and short-term outcome. The primary endpoint is cardiac mortality. Actually, at 30 days, the cardiac mortality was 2.1% in the low volume operator compared to 0.5% in the high volume operator, with significant difference. Also, the 3-year of course cardiac mortality, 2.5 for high volume operator, 4.6 for low volume operator. So the difference is also very significant.
So it's really important that the number and volume is an unusually effective way of determining what the risk is for the patient.
Yeah. If you look at the details, you can see although this actually in the high volume operator group, there are more left main plus 3 vessel disease and more left main bifurcation, and syntax score and syntax score 2 are higher in the high volume operator as compared to the low volume operator. But however, the outcome, not only short-term but also long-term outcome is much better in this group.
Now, Brindis and Demmer, who wrote the accompanying editorial in JACC Interventions, they noted that according to NCDR data, there's like 3,158 interventionalists in the United States doing 8,420 unprotected left main PCIs. So obviously, the vast majority of interventionalists are not doing all that many PCIs. Mm-hmm. What's the lesson here? What should we take away from your study?
Yeah. So I think we have 3. We already drew 3 conclusions. Number one, the patient, left main patient, the complex procedure, such as left main PCI, patient treated by experienced and high volume operator have better prognosis, easy to understand as compared to the low volume operator. But more important, the operator experience should be considered as a risk factor for the future evaluation. I think according to our data, if we can see a discrimination improved when the operator experience were added to a multivariable model or syntax score 2 model. So it means the operator experience should be a very, very important risk factors. Lastly, we think the so-called less experienced low volume operator can perform left PCI, but must be get close supervision and mentorship under the and at least one experienced operator until they get sufficient skill and technique and become independent.
Well, congratulations. I think this is a very interesting study, and I'm really glad that you did it. And I'm really glad you submitted to JACC Interventions, too. That was very nice of you. I appreciate that. For CardioSource World News and CardioSource World News Interventions, we are at TCT 16. Please look around for our coverage. And I'm Executive Editor Rick McGuire.